It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello, I'm Dr. Annie Varghese, and welcome to another episode of Best Docs Network, where we feature some of the finest doctors in Houston. Today, welcome Dr. Guy Lewis, who specializes in cosmetic dentistry.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is, the majority of the time, a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving, there was an SV bit on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was at Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner. And so he's seeing people in the clinic. And so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile. And then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me. He's mean. He
just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate. The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients. I have so much respect for these guys who go and put it on the line for our country, and my dad was wounded in the South Pacific in World War II. And I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
Even in 2013, stress incontinence and urinary incontinence in general is a very big concern for a lot of women. Often starts with childbearing, progresses as women get older, and by late 40s, early 50s, a woman may be noticing she's leaking urine when she coughs or sneezes, when she jumps, when she exercises. Or for a lot of women, the problem is that she can't sleep at night because she has to wake up and urinate frequently. If you have stress incontinence, a very simple outpatient procedure will allow you the ability to exercise without losing urine and may free you from pads and diapers that you may be wearing. But just have to talk about it. In certain other types of incontinence, may require just medications to fill.
And Dr. Imtiaz can also treat her patients with a simple and common outpatient procedure.
So for urinary stress incontinence, my most common procedure that I do is something called a transobturator tape. It's a little mesh that's placed just inside of the vagina, and it sits like a hammock around the urethra. Urethra is the little tube that you urinate out of, and in stress incontinence, the control mechanism out of the bladder is weak. A woman doesn't have the ability to control when urine comes out. When we place this little hammock at the right spot, she will be able to hold urine and be able to cough and sneeze without losing urine.
Thanks to Dr. Imtiaz and these procedures, patients no longer have to live with this very correctable problem.
Now, the interesting thing is that even in today's day and age, women aren't talking about it, and it's a very common problem. And the funny thing is, it's a fixable problem, very easy fix.
Ablation therapy is used to treat arrhythmias that come from the top of the heart, known as SVT, or from the bottom of the heart, known as ventricular tachycardia, non-sustained ventricular tachycardia, or other types of arrhythmias. Now, ablation therapy sounds scary to most people, but it's really very simple. We take the patient to the cardiac catheterization laboratory, sedate them, of course, and then put catheters to find the area of the problem in the heart, and then easily make a tiny burn, and the rhythm is gone. So many people suffer so many years with tachycardias, palpitations, and these things can easily be taken care of with ablation therapy. So I think the news about ablation therapy should be given to the public. So many people are having atrial fibrillation even that don't know that they can get off of their medications by having ablation therapy. It's an interesting topic, something you should look up, and we'll bring more information as we get it.
Prevention and therapy of osteoporosis is one of Dr. Meredith Morgan's specialties. Dr. Morgan offers some suggestions that could help prevent this disease.
If a woman's normal, a healthy lifestyle should be adequate. The question about diet, nutrition, and exercise, part of life would be an active lifestyle. Weight-bearing exercise, say 5 times a week for 30 minutes, is good for cardiovascular, and it's good for the bones. So walking is great. So if a person can do that, that's the ideal for the bone health. Therapy is indicated on a risk factor. If there's been a fracture, it's obvious the disease exists. If there has not been a fracture, but the absolute risk projects to over 20% for a major fracture of the spine, arm, wrist, or a 3% 10-year risk of the hip, then drug therapy is indicated.
Dr. Morgan can adjust his treatment depending on his patient's lifestyle.
There are basically 2 groups of first-line therapy. The bisphosphonates, to use a big chemical phrase, and denosumab, which is a type of immune therapy. These have been proven to be effective and significantly reduce the risk of fracture. Highly, highly preferred to obtain our calcium in the diet. Just make it really short and easy, about 1,200 milligrams of calcium a day. In terms of nutrition, this is very serious. There is controversy, but there's enough evidence to indicate that a person who tries to treat osteoporosis only with calcium supplements or calcium and vitamin D supplements may have an associated 30% higher risk of having a coronary event, a heart attack. It's mainly theory as to why this would happen, and there are some people that don't believe it would happen, but in terms of the alternative managements of the disease or the high risk, we're talking about nutrition, supplements in a reasonable dosage, and the lifestyle of exercise and fall prevention.
was extremely overweight. I was tired all the time. I was a mother of 4. I couldn't play with my kids. I just felt horrible.
Deborah's a younger person. She was morbidly obese, but she was in the lower range for morbidly obese. And she didn't have a lot of other medical problems, and she had her surgery 17 months ago or 18 months ago.
I had the gastric sleeve done, and I decided to have the sleeve done because I'm a nurse, and I had researched the lap band and also the gastric bypass, and neither one of those were really an option for me in my lifestyle. So that's what made me decide to go with the sleeve.
Since then, she's lost all of her extra body weight. She's actually in the normal range right now. I think her body mass index is 23. The risk of the other medical problems emerging that can lead to catastrophic events down the line is lessened quite a bit. So she's in a much safer range.
The recovery period, the first couple of days, of course, are the most difficult. You know, you kind of ask yourself, did I do the right thing, and what did I put myself through? But I think after about 3 days, I really felt good. And then the first week, I had lost 10, 15 pounds. My face looked different already. And so I got really excited. I knew that I had made the right choice, and I just kept going with it. And every time I came back, it was 20, 30, 40 pounds gone. And so by the time a year came, I had lost 80 pounds, 80 plus.
She can exercise much easier. She's consistently exercising. She sleeps better, and there's a whole bunch of quality of life issues that have gotten better.
I think you should be more afraid of the long-term difficulties and problems that you'll have more so than being afraid of the surgery. The health effects that being overweight has on you, it's just tremendous. It's a tremendous strain on you, your family. Whereas with the surgery, you do it, and within a week, you're already losing weight, you're feeling better, you're recovered from your surgery, and there's nothing to lose by doing this procedure except for weight. And you gain your life back in return, so it's absolutely amazing.
For more information about any of our doctors on any of our shows, go to bestdocsnetwork.com or email us at info@bestdocsnetwork.com. Now let's meet vein specialist Dr. Peter Morgan.
A few years back, I started having ulcers show up on my lower ankles. So these ulcers would take 2 to 8 months to get rid of. Once those would heal over, another one would pop up.
We did an ultrasound and discovered that he had severe chronic venous insufficiency with very large varicose veins and swelling. His biggest issues were that he had open, non-healing wounds. He had a very large one on the right side, and he had a much smaller one on the left side. He'd been seen and treated by a variety of people with a variety of methods over the years. None of them had worked.
They say, well, that's not really a problem. We have surgeries that we can do on an outpatient basis. We can get rid of that for you in no time.
We very carefully mapped out which veins were bad in his legs, the ones that are running backwards, and then made sure we understood where the blood was running correctly, and we ablated selectively the bad veins to restore the venous circulation out of his legs back to normal. And that improves the overall health of the leg and improves healing, and he actually healed up very nicely.
The procedures, like I said, didn't take any time at all. Come in the morning, go to work in the afternoon, not a problem. There was no pain after the surgeries. All went well, went back to work, no problem.
You can have wounds that are unrelated to venous insufficiency, but most chronic non-healing wounds are related to problems with your veins. But if you have a non-healing wound, that is almost certainly from venous insufficiency, and we can heal virtually all of those wounds here with the procedures we do.
Having the circulation back in my lower legs allows me to work longer. It allows me to stay on my feet longer. I don't have the foot pain that I had prior. The procedures helped dramatically.
Alcohol has some good and some bad to it. The good is that they say that red wine prevents some heart disease, and I think that's true. It helps reduce the amount of LDL cholesterol, the bad cholesterol, and increase the amount of HDL, which is the good cholesterol. There are downsides to alcohol, though, also. There's a lot of alcoholism in this country that we don't appreciate. Many people are alcoholics and don't even know it because they function so well. You don't have to be sleeping in an alley to be an alcoholic. One question you should ask yourself to see if you have alcoholism is, have there been many times in the past year when you have drank more than 5 drinks in a day as a man, or more than 4 drinks in a day if you're a woman? The general recommendation for alcohol intake is that men can safely get away with 1 to 2 drinks a day, and women 1/2 to 1 drink a day. This may be good for you in some ways, and if you stay under that limit, you won't get into the bad level. You ought to check with your doctor on this and ask him or her about that, especially if you have a family history of alcoholism.
For additional medical minutes from Dr. Honaker, log on to bestdocsnetwork.com, click on Education, and the Medical Minute tab.
Coronary disease is a type of vascular disease where plaque coats the inside of the vessel to the point where there's a growth, and that's called stenosis. The number one problem with regard to formation of plaque is cholesterol. So we have different types of cholesterol, LDL cholesterol. We have HDL, which is the good cholesterol, LDL being the bad. Triglycerides are another bad cholesterol. So it's very important to do advanced testing of the lipids.
Back in 2000, I went working, had some pains in the chest, went to my general practitioner. He examined me and said, "You need to go see the cardiologist today." Made an appointment for me with Dr. Barghese, and when she examined me, she said, "Just stay right there. You're going to the hospital."
The case of Thomas Cole is quite interesting. He came at the beginning of my practice years. I've been practicing for 18 years now. And Thomas Cole came as a new patient and just complained of intermittent chest pain. We proceeded to take care of him, and he proceeded to die on the table and had no heartbeat. So we, of course, started resuscitative measures immediately and quickly transported him to the cardiac catheterization laboratory. Found a severe blockage in the right coronary artery, and that's why he had become hypotensive. His blood pressure had dropped, his heart rate had slowed down to nothing, and it had stopped. So in the office, I pounded his chest and started CPR, and then we took him to the cath lab.
I was very lucky. I mean, if you're going to have that kind of thing happen, being in a cardiology office is one of the better places to be. The thing that's most amazing, I think, about Dr. Barghese is her concern for her patients and her constant drive or constant searching for things to help them, not only when they've had the heart attack, but help in prevention of the heart attack. Her personality of her patient care is phenomenal.
For additional health information, be sure to check out our Healthy Living blog for the best tips, latest medical procedures, and up-to-date news for modern medicine at our website at bestdocsnetwork.com.
Today we're here with Dr. Reynolds Delgado at the Texas Heart Institute. He's the Director of Cardiac Transplantation at the Texas Heart, and we're so happy to have him with us. Dr. Delgado, thank you for being with us today.
Well, thank you, Annie.
Now, we know that cardiac transplantation is something that seems so far removed from most people, but really so many people are in need of this great help. And can you tell us a little bit about how you evaluate a patient for transplant?
Yes. Well, first of all, there's a lot of people that need it, as you say. Around 6 million people in the United States have heart failure, and a good proportion of those need a transplant. The problem is we only have around 2,000 donors' hearts available to us in the nation per year. So we really have to focus on those patients who can get the most out of those 2,000 donors. And so really that's the focus when we're working somebody up for transplant, finding someone who's going to live a long, healthy life after the transplant.
Exactly. Now, there are several ways of helping the patient, right, with assist devices. Would you kind of mention those for us?
Yes, and the transplants are a limited resource, so we only have that limited number that we can do per year. But there are other things we can do that are not. An example is the artificial heart devices. These are known as LVADs, or left ventricular assist devices. And these are small motors, small motor pumps that are tiny, about this big, that can be implanted with a surgery in the chest, underneath the heart, and they can pump blood for the heart. And so really in a failing heart, we have other alternatives like this.
We see that there's hope for people who can't even get a transplant, but they could come and be evaluated for even this assist device.
Absolutely, absolutely. There's so much we can do beyond transplant. And as for transplants, we do many of them. We did 57 in 2012. That's a lot of transplants. It's one a week. But one thing it's important for people of Houston to know is that herein, where we are standing and sitting, is the greatest med center in the world. Just right there, it's the greatest cancer hospital in the world, and here is the greatest cardiac hospital in the world. And within this med center, we can do just about anything that's doable in medicine.
That's excellent. Thank you, Dr. Delgado. We really appreciate you.
Thank you, Annie.
The symptoms is I had headaches, a lot of congestion, infections in the throat, a lot of mucus in the back, ear headaches, so much stuff going on.
Janice Martinez is a patient who came to my office complaining of nasal obstruction, facial pressure, constant headache. She has been treated under multiple medication, including antibiotics, antihistamine, nasal spray, without really without any good success.
I went on, but then I started getting infections, and I was on antibiotics for 4 months in a row. They kept giving me, so I was like, this is not good.
So when we examined Miss Janice Martinez, we found that her natural sinus drainage pathway, it's obstructed by chronic inflammation, chronic infection. So we offer her the option of doing balloon sinuplasty.
The best part was the breathing. I could breathe again. The headaches, little by little, started going away. Now when I sleep, I would breathe real loud. My husband will always say that, and I don't do that no more.
So when you have a chronic sinus disease, that passage, it's obstructed, it's narrow by chronic inflammation, chronic infection. So what we do is we put a small balloon in the passage, and we open up, you inflate the balloon and open up the natural passage, preserving the normal anatomy.
And I don't sound like I have colds all the time. Before I was like sick all the time. And now I'm doing great. I could go out, do everything, and I feel good.
One of the advantages is the quick recovery. There's really no downtime to balloon sinuplasty. The procedure can be done in office, under local anesthesia or the topical anesthesia with some nasal spray. There's not really a recovery time for balloon. The patient can go back to her daily activity the next day, and compared to a traditional surgery, which the recovery can last to a week.
Coronary artery stenting is a part of interventional cardiology that I absolutely love. It's been around for about 30 years now. Initially, the great giants of cardiology formed a cardiac stent, which is just a metal mesh that we place on a balloon catheter, place it into the coronary artery that's obstructed, open it up, leave the stent, and remove the balloon and the catheter. easy procedure, but years ago it was quite difficult, and catheters were larger, there were a lot of bleeding problems, but now the catheters are quite small. The procedure is fast, done quickly and without much discomfort at all for the patient. If a patient presents with coronary artery blockage, they can go to the cardiac catheterization laboratory, have the coronary angiogram procedure done, and then if there's a blockage, we can place a stent right at the same time. Coronary stenting has protected many patients from going to cardiovascular surgery, has improved lifestyle, and many patients have gone without symptoms for many years because of coronary stenting. We thank the developers of coronary stenting, and we look forward to a future of great developments with regard to the coronary stent.
We are 1 million strong. We are united behind a cure. There are over 1 million colorectal cancer survivors in the United States. My name is Charles Kelly from Lady Antebellum, and I'm in this fight against colorectal cancer because it actually hits pretty close to my family. My father-in-law was diagnosed with it, and the thing about this disease is it is preventable, and so I encourage everybody to go get screened. Let's beat this thing.
Yeah, I lost a couple, and the rest of them started getting loose, and it was something that took about 5 or 6 years to happen. It just suddenly came on, though.
Yeah, George, his teeth were in an end stage and that they were decayed, and he also had periodontal disease, bone loss around his teeth. His teeth were chronically infected. They had become loose. Also, there was a cosmetic problem with his teeth, and George is a very outgoing person and likes to smile and has a great smile, and so his smile just didn't suit his character, not to mention the health of his teeth. It was really driving him down.
I was kind of getting to the point where things that required real chewing, particularly in the back of my mouth, was getting more and more difficult.
With George, what we did was removed his teeth. Now in him, we focused on his lower jaw. And from a financial standpoint, many individuals decide to maybe focus in one jaw versus the other. Now granted, with him, we could have done both of them simultaneously, but for whatever reason, and oftentimes it's schedules, their busy work schedule, also finances, that they'll sometimes stagger the case to suit them better. And with George, we focused in his lower jaw, and we removed all of his teeth, upper and lower, but we put the implants immediately in his lower jaw.
I'm feeling fine now. I'm back to the point of eating anything. There's no problem. We're continuing on. I'm not quite through with all the procedure, but just about.
And that is a misconception that we're seeing right now with the advertising, where it talks about get this all done and completed in one day. Reality is the final is usually done later down the road once the body has fused to the implants, and the textbook answer for that is at least 3 months, but it can be as long as anywhere from 3 to 6 months. But the standard of care is to keep the patient in a provisional, a prototype, if you will, for a period of at least 3 months.
According to my experience, no question about it. Don't be waiting on it. The earlier you start some treatment, clearly the better.
Thank you for joining us for another edition of Best Docs Network, where we feature some of the finest doctors in Houston. For more information about any of our doctors, go to bestdocsnetwork.com or email us at info@bestdocsnetwork.com. For Best Docs Network, this is Dr. Annie Varghese, and I will see you next time.